Hi everybody, happy Thanksgiving week. I wanted to say thank you to everybody for voting our office best physician in Rockwall, Texas. It's a great honor. It's obviously a team effort and I appreciate it. I have a lot of great support staff. I have Lisa and Dana as my nurse practitioners. I have Dr. Andrea Heikkinen, who was also honored recently. I've got my little cheat sheet here so I don't mess it up. 2015 Woman of the Year is awarded by the World Congress of Women Chiropractors. So congratulations, Dr. A. So again, thank you all very much. The topic I wanted to cover tonight is heart disease, and a lot of you are probably thinking, well, I know there are certain historic risk factors for heart disease, and some of these still hold true. Cigarette smoking, high blood pressure, type A personality, diabetes, physical inactivity. Those things date back to when I did my master's program at the University of Connecticut with Dr. Stephen Sinatra, board certified cardiologist from Yale, who taught my electrocardiography course back then. In recent years, in fact, April 17th of 2013, Dr. Sinatra was on Dr. Oz's show, and he was talking about his book. He had his book with him called The Cholesterol Myth. And Dr. Oz said, so Dr. Sinatra, apparently you don't think that high cholesterol is the end-all, do-all, say-all with respect to heart disease. What do you think the problem is? He said, I think it's inflammation. In Gonino speak, I think it's rotting and rusting. Fungus, toxins. IV hydrogen peroxide, IV chelation. These are two tools that we have in this office that have been researched and published, and that we've been able to show regression of plaque, carotid artery plaque, coronary plaque, using these treatments. Recently there's a new marker out now. It's called Homocysteine, which you can measure the inflammation in your arteries. So we can do this now, and if your homocysteine level is high, we can lower your homocysteine, decrease your risk for heart attack. I believe cholesterol is actually a secondary player. In other words, I think if a person's walking around with a 300 cholesterol, they're more likely to clog up an inflamed artery than if they're walking around with a 130 cholesterol. But in my opinion, and the main reason I wanted to speak to you guys tonight, is cholesterol to me is a secondary factor. This is the issue right here. It's inflammation of the artery. And if you can control this, I don't think cholesterol is really much of a player. And historically, what's been used to treat heart disease and cholesterol was statin drugs, things like Zocor, Lipitor, and things like that. So I think medicine has kind of missed the boat a little bit. I think they've had their focus over here when it really needed to be over here. Statin drugs, in fact, April 11th, 2012, Journal of the American Medical Association, healthy men should not take statin drugs, and they actually cited the Women's Health Initiative as part of the data here. With respect to that, study showed an increased risk in women of type 2 diabetes who took statins. And the rest of the article was talking about things like cognitive decline, liver dysfunction, kidneys going down the tube. And they basically concluded advising healthy patients to take a drug that does not offer the possibility to feel any better or live any longer and has a potential decrement with quality of life is not in the patient's interest. So at any rate, I wanted to give you guys that, and hopefully you're focusing on your inflammation, controlling this factor. Cholesterol secondary issue. If you're on a statin drug now and you aren't at super high risk, i.e. you haven't had a heart attack already, you may want to reconsider converting that therapy or just stopping it and moving more to a more natural framework of attacking that particular issue. So hopefully that was enlightening to some extent. Again, happy Thanksgiving, have a great week, guys, and I'll be back with more news in hopefully not too distant future. Bye-bye.